And these are just examples of how images are seen. So this is a 3D image of the baby, the first one. So you can see as the baby is bigger, you get nicer, chubbier, chunkier baby. So look at this baby. This is a 35 weeks baby, but not all the time you can get 35 weeks baby, yeah? So this one is probably a 20 plus baby. So when is the best time to do 3D 4D scans? This one is really up to your machine. Ideally, a 1 kilo baby would be nice to see. Of course, the chubbier the baby is, the cuter it will be seen in the ultrasound, but there will be also lesser movement and show his or her face. Okay, so ideally about 1 kilo, ideally about 28 weeks to 30 weeks, which is the best time to do 3D 4D. But you can actually start doing it as early as you want. You know, you can start doing it at first trimester, early second trimester. You can. It's just that the baby will not be so chunky and it will not be so cute. Let's look at what can we actually see with 3D and 4D ultrasound. Well, basically you can see whatever that you want, you can see in 2D. If you can see in 2D, you can also generate the image to be in 3D, 4D. It's just that some images are not nice, some images are not seen clearly. So I've listed 4 types of parts that can be seen clearly if you were to do a 3D, 4D ultrasound. So obviously the craniofacial anomalies can be nicely seen because we use 3D, 4D to look at babies' facial. Okay, then you can also see the spine anomaly. You can also see spine, and then you can see the limbs nicely. Okay, for limbs, actually it's just easier to do 3D, 4D for limbs. For example, if I were to do the limbs for detail scan, I will just on my 4D just to see the limbs. It's just easier because you can see the whole thing straight away. Okay, and then if you can see abdominal wall defects, you can also see it in 3D, 4D. So basically, why is it nicer? Okay, the view in 3D, 4D makes it easier to understand the anatomy of the diagnosis. So basically, when you already do your 2D, you should be able to have a bit of a diagnosis already. You should already know, okay, there's something going on here, and this is where I want to see more. And that's where you do your 3D, 4D. And then, and this is because you can demonstrate targeted areas in few different views, which is the axial, which is the coronal, which is the sagittal. So that's why you can see abnormality nicer in 3D, 4D. It sort of gives a confirmation on what you want to see. For example, if you're not sure, let's look at this. So I'm sure, doctors, you know what is in this image. So this is a baby with a cleft lip. Look at this cleft lip, this small cleft, yeah? Then this is in 3D, cleft lip also. Okay, so if you look at this image, straight away you know, okay, there's a cleft lip. Whereas if I were to show you the 2D image, you may not be able to imagine which part of the baby that I am showing. So this is actually the nostril, these two. So again, this is a coronal cut of the baby to see nose, lips, and chin. So this is the nostril. This is cleft. This is upper lip, and this is cleft, and this is lower lip, and this is chin. So if you see this in 2D, this is what you will see in 5D. Okay, and this is what you will see in 3D. So you see, this is how it is easier to see things in 3D, 4D. And I want to show you one of these rare case that we saw. Yeah, this is a 29-week baby. This is a cleft at lower lip. Okay. I don't know if that's common, but this is the first time I saw it. Cleft at lower lip, which we confirm with 3D, 4D ultrasound. The upper lip is fine.